Hello, I am Dr. Praveen Chandra from Medanta Hospital, Gurgaon, and let me tell you that many patients who are coming to us with multiple blockages or very hard blockages, these days we are able to treat them also where angioplasty was not possible earlier. Now we can do it with the help of shockwave therapy, which means we break those calcified hard blockages of the heart by the help of a microcatheter without opening the heart. And this is a non-surgical technique, takes about 30 to 40 minutes, the whole procedure. It is as angioplasty is done, and typically the patients are discharged the very next day. And we have been able to treat a large number of patients, and these patients really do reasonably very well, and they just require some medications for a follow-up, and they are able to go back to normal life very soon.